Hello, I'm Dr. Stephen Blomerth. Welcome to Natural Health Today. This is a show dedicated to your concerns, your problems, your questions, and we invite you each episode to participate with our show through a variety of means. You can send in questions you might have about yourself or a loved one to pbdchiropractic@gmail.com, or you can send in your questions by calling my office at 978-535-6155. You can even send a old-fashioned handwritten in pencil snail mail letter to my office address, which is 215 Newbury Street, Suite 102, Peabody, Mass. 01960. But whichever way you choose to participate in the show, what we'll do is slightly disguise your name so your friends and neighbors won't know the exact nature of your question. And we'll talk about natural health means to help you. And when I say natural health, there's 4 avenues that I usually think of. One is manipulation or moving, adjusting of joints that are stuck. That can have far-reaching consequences in getting a person better who's been in pain for a long time. When a joint is stuck, it not only can give pain, but it also can decrease function in areas far away from that joint. Another is muscle therapy. When muscles have a problem, sometimes they don't always hurt, but they harbor trigger points. In trigger points, there's, for instance, a trigger point on the back of your shoulder blade. When that back of the shoulder blade hurts, you might feel pain in your shoulder. You might feel it all the way down to your wrist. So muscle trigger point therapy is an equally important part of natural health care. And the third avenue is exercise. And I'm not talking about the types of exercise that people get in gyms, because the type of exercise in gyms usually emphasize certain muscles that we exercise far too frequently. A gym is good if you need to be a strong man or lift huge weights, but I think most of us, for the most part, just want to be fit. We just want to be stable. We just want to not have pain and problems. And those type of exercises are best done by watching videos brought to you by foundation training people. The foundation training people are the best exercises I've seen in 37 years of practice, because they help strengthen the muscles that are weak and stretch the muscles that are too tight. And by doing so, make you stronger. And the last avenue of natural health care is nutrition. Nutrition is sometimes the last in the line of what we consider to do for our health, but nutrition has an overarching effect that can last for years. And the closer that we eat to a low carbohydrate, high fat, and small amount of protein diet, the healthier we'll be, not only for the weight loss, but also for energy and for healing. So those are the 4 avenues that we find that will address probably 80 to 90% of the day-to-day healthcare problems that people bring to the medical doctor. And they usually are handed prescriptions for drugs or referral to a surgeon. Drugs and surgery are not needed for 80 to 90% of day-to-day healthcare problems. They can be helped by natural health means. So I'm going to put on my reading glasses, and we'll have a look at some of the questions that have come in since our last episode. We'll try to talk about means to help people. Okay, our first question comes from Mary Ann. Mary Ann writes from Danvers. She says, I've been very conscious of trying to avoid germs ever since I was a kid. My mom taught me to wash my hands, and now I use a good antibacterial hand cleaner. So I was really shocked to break out with these itchy spots on my hands and elbows. I've tried switching soaps and using a moisturizer, but nothing helps. Are there any good natural cures for this? Well, Marianne, I don't know, without having a look, exactly the nature of why you may have itchy spots on your hands, but sometimes it can happen from using too much washing, too much cleaning. People have studied what they call the microbiome. The microbiome is just a fancy name for the microbes that is the good, useful, necessary bacteria that live all over us. And most people hate the thought that there are germs that live on the surface of our skin. But these germs that live on the surface of our skin, these good ones, keep us healthy. And if you constantly wash them off, if you don't get exposure to some of these things, you can develop problems over time. So a simple solution is to start washing less frequently, only when your hands are absolutely dirty. And you can even find sprays these days. There's one called Mother Dirt. I know it sounds a little counterintuitive to spray bacteria on you, but it's the same sense that it makes in terms of our intestines, because our intestines are filled with bacteria that we need. We can't live without the bacteria that live in our intestines. What the good bacteria do in our gut and on the surface of our skin, they keep invaders out. And it's like having a good tenant in an apartment. If you kick out the good tenant, you may allow bad tenants to move in. So these good tenants, we know about those in the gut. That's why people take probiotics. That's why people sometimes eat yogurt or take lactobacillus capsules. But the same applies to our skin, because both our skin and the lining of our gut are made out of the same material. Our skin and the lining of our gut are called epidermal tissue, and that epidermal tissue is its only natural normal to have a certain degree of bacteria living on them, and the right bacteria are going to be good for you. Whether your problem is a problem with lack of bacteria, the good bacteria on your skin, but that would be a simple place to start. There are other reasons why people can have itchiness or redness to their hands and arms. That might be a good place to start. And the reason why I mentioned that is because you mentioned your mother emphasized that as a kid. If you've been doing it for a long time, you may have never been exposed to the healthy bacteria you should have been exposed to when you were a kid. And thanks for that question, and I hope that'll help you. Okay, our next question comes from Brad from Middleton. He writes in, I got into a car accident about a month ago, and I wasn't too bad for the first few days, but this past week, the pain is terrible rolling over in bed or going downstairs because I can't bend my knee. I had a slip disc 15 years ago. Could that slip disc be coming back? The last time a chiropractor fixed me, do you think that can help again? Well, Brad, it's hard to know from your description what your problem is, but I can say that type of reaction, having an injury a month ago, a motor vehicle accident, not feeling bad initially and then feeling bad at some later time, is not that uncommon. It's not unusual for the first few days, sometimes a week, not to have many symptoms. But depending on the circumstances of a person, particularly if a person has had a bad disc in the past, yes, it is possible for a disc problem to come back. The older we get, it becomes a little bit less likely, but Brad didn't tell us how old he was. All he did was said that he had a disc problem 15 years ago. However, once we get into our 60s and 70s, the disc problems are far less frequent because our disc essentially dries up, because our disc is a bit like a sponge. And when we're young, our disc is a bit like a sponge that's full of water. And when it's full of water, it can have more problems than the disc when it gets old. When it gets old, it kind of dries out. So we don't get a leaky disc too often when we are in our 60s and 70s. But if Brad is in his 40s, perhaps he's having another disc problem. Can he be helped again? Well, 15 years ago, it all depends. How healthy have you been since then? Have you kept your weight down? Are you taking any medications that might work against you? I've known some patients who had disc problems in the past, and then they gained 40, 50 pounds. They start taking statins, which is a bad idea for just about everybody, because it affects your nerve level and also affects how much nutrition you get to your nerves. There's a lot of factors that go into feeling better. It is a good sign that in the past you responded well to a chiropractor taking care of you. Will it help this time? It's hard to say without examining you and getting a little bit more in-depth information. But Brad, I would say that's a good place to try. And, you know, ask yourself those same questions. What kind of a shape am I in now? Am I about in the same shape that I was 15 years ago, or have I let myself get very heavy? Am I taking many, many drugs? Because there are people like that. They gain a lot of weight. And I saw a patient the other day who was taking about 15 different drugs for blood pressure, for fluid in his feet, for allergies. Taking all those drugs, that drug cocktail on a regular basis, that knocks down our ability to recover from just about any injury. So with your back injury, with the potential for having a disc problem, you may have created a situation that's hard to get over. But again, consulting with a chiropractor is probably a good idea because you had success in the past. Brad, let's try it again. Let's go on to our next question. Jerry Ann writes in from West Peabody. She says, I don't get pain into my back. I just get pain into my left leg, a little bit above my knee, and up and to the outside portion of my knee. It only happens when I go to get up out of a chair and when I lay on it at night. Would a heating pad help? Jerry Ann, just like Brad, it's hard to say without examining you whether a heating pad is going to help. I almost always, when I don't know for certain a person's status, say, rather than trying heat, try ice, because heat is so comfortable. Many people fall asleep with heating pad on and they'll inflame the area. The thing about a heating pad, particularly an electric heating pad, it doesn't lose its heat. A cold pack, an ice pack, it only gets, it's only going to stay cold and be cold for a finite amount of time. Whereas a heating pad is going to generate that heat as long as you have it plugged in, as long as the local power company is pumping kilowatts into your house. So how can you help yourself in this type of situation? Well, if your pain is coming on into your, and from your description, it's not so much your leg, because most people don't realize that your leg starts at your knee and below. Above your knee and up to your hip, that's called your thigh. So if you're getting pain into your thigh, and as she says, a little bit and outside of your knee, that's a classic area for a pain referral from your hip. And if you lay on your hip, particularly there's a part of your hip bone that's very prominent. If you take your hand, slide up the side of your thigh, and find that pointy bone that's up by your knee, up by your gluteal area, that thin area of bone right there, it has a funny name. It's called the greater trochanter. And people can have something called trochanteric bursitis. Well, it'll be very, very painful right on that spot, but also when that spot is irritated, it can refer pain down into the upper thigh, as far down as the knee. Sometimes even the knee can hurt. So people say, oh, I have leg pain, knee pain. What they really have is thigh pain that's coming from their greater trochanter area and their hip. If your pain is not so much in your back, but only comes on when you're getting up out of a chair or rolling over at night, that does sound quite a bit like a hip joint problem, because if it was happening all the time, you'd have more pain in your back. So, Jerry Ann, would a heating pad help? I would try cold. I wouldn't go more than 15 minutes on the cold, and I would put it not necessarily where you're feeling the pain. I would go a little bit higher into the outside, the outer edge, and put the pain on that. And when you're laying in bed at night, I know you've probably already stopped laying on that side, but when you lay on the opposite side, that's painful side can be stretched by laying on your side. So put a pillow, or maybe two, maybe even three if they're thin pillows, between your knees so there's a little bit less tension on that, and see if that helps give you a little bit less pain. It's the type of thing that can be treated by conservative means that we do. We manipulate the hip joint. We do some ultrasound therapy to the greater trochanter and the surrounding muscles. We work out the trigger points. A lot of people will get better from that. It's not a sentence of having to have pain the rest of your life. It just means it has to be treated properly. And many, many people, well, unfortunately, will be sent to have an MRI to see if they have a slip disc in that area. But I don't think that, to me, sounds like the slip disc kind of a syndrome, Jerry Ann. Try conservative care first, and try the ice, and don't do the heating pad quite yet. Our next question comes from Ed. Ed writes in from Danvers. He says, I stay pretty fit. I work out 3 days a week and watch my weight, but I keep feeling really tight between my shoulder blades, even when I stretch my back on an exercise ball at the gym. Are there any special workouts I can do to get rid of that tight feeling between my shoulder blades? Well, that tight feeling between a person's shoulder blades, there can be a few different causes for that. And what the information that we just received from Ed was that he works out 3 days a week at a gym. If you're working out 3 days a week at a gym, it's pretty likely that a person who works out 3 days a week at a gym may be doing a lot of push-ups, maybe doing a lot of bench press, maybe be doing a lot of this. It used to be called pectoralis press, okay, this type of thing. All those exercises work your muscles in the front of your chest called the pectoralis. And when these muscles in the front, your pec major and pec minors have trigger points, they pull us forward. When these are tight and they pull you forward, you feel the strain, you feel the tension, and you feel the discomfort in between your shoulder blades. And most gyms that I've seen, they don't really have a good system for working the muscles in between the shoulder blades. Now, a few weeks ago, I think we showed a video, well, we showed me emulating the information you can see on video online called decompression breathing. I would try that. But of course, people can also have joints in their upper back that are stuck. People can even have neck joints that will refer pain down, in between the shoulder blades area. So they may need a variety of things, but a simple home thing that you can try yourself is, for a while, stop your push-ups, stop your bench press, stop this type of exercise here, flies, pec flies. Stop those and maybe do some trigger point work on yourself. In other words, use your own hand, find areas of tenderness. And I'm talking about areas that really make you jump, that are surprisingly painful. Just go back and forth across the grain of those fibers, and do it long enough so you feel maybe a 50% decrease in the tenderness. Between that, laying off of those exercises that strengthen the pectoralis, and doing some decompression breathing that I mentioned a few weeks ago. Decompression breathing by foundation training people you can find for free on YouTube. Try those things. That can help a lot. And last but not least, getting your back adjusted. Not only in between the shoulder blades. That can be too obvious for many people, but there are other areas like your neck. Your neck can refer pain to in between your shoulder blades. You might have knots and trigger points in some muscles that refer pain to those areas. All those are nice conservative things that aren't dangerous to have performed and will contribute to your overall health and may help your symptoms go away. So thanks for that question. That was a good one. We get a lot of questions about people who work out on a regular basis, and most of them tend to work out the wrong muscles. Okay, Linda writes in from Danvers. She says, I know salmon is good for you, but it always makes me burp a lot whenever I eat it. My friends say I should try grilling it during the summertime. Do you think that grilled salmon would be better and help me not burp so much? Linda, it might. One thing that's different about salmon than most of the fish that New Englanders tend to eat, we tend to eat the fishes that are white. We tend to eat the haddock, the flounders, cod, all those white fish. They don't have as much oil in them. And one of the benefits of salmon is the oil that's in the meat of the fish. That oil is some of those omega-3 oils, and those omega-3 oils are very, very good for us. So that's why people so often recommend salmon. But salmon, for some people, it can have too much of that oil, and that oil can be hard to digest, depends upon your own digestive system. So there are a few workarounds. You can try grilling it on the grill. You can also try taking a supplement, a dietary supplement that helps you digest fats. There are certain dietary supplements that have enzymes in them, because enzymes are what help break up fats. And the interesting thing I didn't ask you, or you didn't have a chance to mention, if you've had a gallbladder, removed, your gallbladder puts out what they call bile acids, and the bile acids are crucial in helping to digest oils of all types, not only from fish, but oils of all types. So that can be another solution. Have you had your gallbladder out? You might need to take a supplement with enzymes in it that have some of those bile salts to help you digest the food. And the last thing I might mention is some people have food sensitivities. It's not the same thing as an allergy. You know, you've probably heard of food allergies where people will eat a little bit of something, like a shrimp or a peanut, and all of a sudden their throat will close up, and within minutes they have to be taken to the hospital by ambulance because their airways close up and they can't breathe. A food sensitivity doesn't work like that. It doesn't have immediate effect. You might not see the effect even that day. You may see it several days later. It's sort of cumulative. But one thing's for sure, if you have a food sensitivity to a given food, you will pretty much all the time find that you burp because your stomach just doesn't do well with that type of food. Could it be eggs? It might be eggs. Could it be salmon? There's so many different food sensitivities. Food sensitivities in general happen when people eat foods that are protein foods. Not all the time, but the proteins in foods are the things that send up these sensitivities. And sensitivities are an autoimmune function where your body reacts to a certain food, not only because it can't digest it, because it triggers this autoimmune reaction where you start attacking your own body. There's many different forms of it. They're not all that uncommon, and in fact, statistics indicate that they're becoming more and more common. So a food sensitivity could be why you're burping when you eat salmon. So I would say forego the salmon. If you try changing how you cook it by grilling it, if you try taking bile salts and that doesn't help, if you try taking the enzyme, the pancreatic enzymes that help you break down the fat, that doesn't help, you may just have to say, I can't eat the salmon. You can get the omega-3s in a pill form, and many times when you just have the pill form, because the pill form is just the oil, and oils in general don't cause us to have those same sensitivity reactions. Try that out. Sorry you can't eat salmon. You can try different ways, but ultimately there's many other fish in the sea. There's many other foods you can eat. I know salmon is nice and tasty for some people. It's not for everybody. So if you can't eat it, there are other things that can take its place. So we've just about run out of time and material now for watching Natural Health Today, so I'd like to say thanks for watching Natural Health Today. I'd like to invite you to participate in the show, and you can participate in the show in 3 different ways. You can send your questions, concerns, and problems into peabodychiropractic@gmail.com. You can call my office at 978-535-6155, you can send me an old-fashioned handwritten snail mail letter to my office address, which is 215 Newry Street, Suite 102, Peabody, Massachusetts 01960. Whichever way you choose to participate in the show, we'll slightly disguise your name, we'll talk about natural health means to get you better, and we'll let you know if you can be helped by simple, conservative, natural health care, because 80 to 90% of people can be and don't need to bring their problems to their medical doctor or surgeon, because drugs and surgery, it can be a bad road to go down unless you absolutely need those things. Choose natural health means because they won't make you any worse if they don't happen to work out. So thanks a lot for watching. I'm Dr. Stephen Blomerth. Thanks again for watching. Bye-bye.